and I work as the head of mental health for the Bradford District and Craven Place Partnership, and focus mainly on the community mental health side of things. And just want to let you know that this session is being recorded. So please can I ask all colleagues to mute your mics so that we don't have any background noise, because we might share this recording with people who are not here. So just a little bit about Stay in the Know. This is our second Stay in the Know session, and these were created this year through the evaluation we received last year from our Healthy Minds Road. Shows that it'll be good to keep in touch with our transformation ambitions and what we are developing the system. So Stay in the Know is very much about changes to our community mental health services sessions. Our first session we held in January was focused on Ramadan and the SMI as a hot topic. This is again available as a link for you to view in our partnership website, which will be dropped into a chat box soon. So there is an area where you can go and find out a lot about what is happening and what are the key services we are coming on board and what are the major things happening within our transformation ambitions. These are a brilliant opportunity to bring the colleagues from across the partnership, from a system, and to be part and work with us on our community mental health transformation journey. And for us a chance to ask questions and and just to get to know each other as well. So we are planning few more through the year. So watch out for more kind of comms from our comms team. So why are we making changes to the way we work in the community mental health services that are being delivered? We have been doing quite a bit of work within Bradford. This is the 4th year of our journey, I think, and incrementally we have been transforming our services and improving the quality of what we deliver. So as a short recap to our program, over the next few years, we are transforming the way the community mental health services are delivered. These changes will improve the way people with severe mental health illness access services within their communities, which could be closer to know. This is not just specific to Bradford and Craven, it's happening nationally. We want people from our communities to receive a seamless service. That means that the NHS, local councils, voluntary and community sector organizations are working together and acting as one to deliver our services. Moving on, as per the operational planning guidance, there is a bit of a focus on having community mental health nearer and closer to home in our neighborhoods. So we are working towards that to kind of really develop our integrated neighborhood health teams, which includes mental health as well. Our aim is to deliver high quality, safe services to keep people happy, healthy, and at home. There's a lot of work happening and quite a lot of services in place. A lot of services we are in the process of improving, developing our pathways or clarifying the pathways, work within the primary care, for example, or ASK practitioners, which is mental health practitioners and PCNs. You can find out about this in our partnership website. So if you have got any questions, please add them to the chat. And we do have a question and answer session at the end. We will respond. If not, we will take away the question and come back to you. So back to today, why are we here today? The hot topic for this session will focus on the role of our voluntary and community sector partners in transforming the program and how they are delivering community core mental health services. So we have got colleagues from the Cellar Trust, Bradford District and Craven Mind, and Inspire Neighborhoods. So would you like to come on board and introduce yourself, please? Sadika, Hisham, and Shelley, and anybody else from your team. Thank you.
I will make start. So my name is Hisham Al-Mahani. I'm a senior service manager for adults and older adults. You might see me in other services. However, I'm today as part of the community core representing Mind, Bradford District and Craven Mind.
Hi everyone, I'm Sadika. I'm a health and wellbeing manager at Inspire Neighbourhoods, and I'm also the service manager for core at Inspire Neighbourhoods.
And I'm Shelley. I'm programme manager at the Cellar Trust, but I'm also the service lead for core at the Cellar Trust.
Do you want to make a start, Sadika?
Yeah. So today we're going to be talking about the community core as Rashmi just introduced, and as we've just introduced ourselves. So we work in partnership across our 3 organisations. And to tell you a little bit about what core is, our vision is to bridge the gap in mental health care between primary care, secondary care and the community sector. And the idea is that we provide community-based, flexible support to individuals that have severe mental illness. And so this isn't limited, but does include psychosis, bipolar disorder, personality disorders, eating disorders, as well as complex post-traumatic stress disorder, anxiety disorders, depressions, and a whole host of other things. But again, it's not limited to just this list. And the idea is that we're trying to help those that would fall between the gaps between primary and secondary services, people that might not necessarily be right in terms of getting support from those services. And the idea is to reduce strain on traditional care systems and really making sure that we offer personalised, goal-focused support. We're to the next slide. So what exactly is Community Core? So the way that we work is that each of our organisations provide non-clinical mental health support to individuals. We work very much on a one-to-one basis with individuals that might not necessarily be diagnosed with severe mental illness, or they may be diagnosed with a severe mental illness. A diagnosis is not necessary, but it will be someone that does have a severe mental illness. And we work with them together on a one-to-one basis, identify what it is that they're needing in terms of support, and really focus on a goal-based outcome approach to help them reintegrate into society, whatever it is that they might need support with. And again, the idea is because we are each so integrated within the community, that's the kind of help that we'll give them.
So it came to me now. So who's involved in this good work? So the beauty of this project, it's a collaborative work across different people. And as Rashmi mentioned at the start, it's working with the VCS, working with the NHS. So it's really good, and I really have passion for this project because we all together. And if I link this to the transformation that hopefully will happen soon, that when we have like service members or patients coming in there, everyone will be able to help them. It's not necessarily like will be the GP, will be the VCS. This is our hope and our aim. So as we discussed that, we have Inspire Neighbourhood, we have Bradford District Enclave in Mind, and we have the Cellar Trust, and all of them we are working together with the support of the VCS Alliance, and we have regular meetings with like the ICP. We discuss, and the beauty again with this project that we try to do the same thing across the board. So whatever Mind is doing, we try also to do the same with Cellar Trust. The same if like Inspire Neighbourhood have like a brilliant idea, so we cascade this across the whole thing. So if somebody is in one of their GP practices getting support, supposed to be getting the same support that Cellar Trust or Mind or Inspire Neighbourhood providing. So as you can see here, there's a list of the PCNs, which is the primary care networks that we are looking after. So each one, like Inspire Neighbourhood, is the BCN 4, 5, and 6. Cellar Trust is North and West and 5 Parks, and Affinity for us is Bingley Bubble, Wish, and 5 Lane Ends. And because we talked about the having make sure that we capture people who don't want people to fill between the gap, this is where we also liaise with the CMHC locality that we are. For example, like with Mind, we are liaising with CMHC North. So people who are not meeting the threshold of CMHC and being referred by the GP, then they can be directed to the service. We also, when we have somebody from the CMHC and they are working with them and they feel that they could be going into the community, then there will be warm handover to our service, and we can work together with them. Service member in terms of the support needed. Can we go to the next slide, please?
So just a bit of a breakdown of what the support actually looks like. So during the initial assessment, the support worker and the individual will discuss the preferences and the need. So the appointment type, the time, the goals, different things like that the individual is looking to work towards. We offer telephone calls, video calls, and face-to-face appointments, which can also be held in the home, or it can be a community setting, just wherever they feel most comfortable. If someone they do have a preference for home visits, we would then make one of the goals to be to get them out of the home. Appointments are offered on a weekly basis, but can be bi-weekly depending on their needs, and this can be up to 60 minutes. The support worker will try to accommodate the best time of day, although we operate a Monday to Friday service, and it's generally 9 till 5. And then they'll also look to set up to 3 goals, which we can then use to guide the support. I do apologise if anyone can hear any drilling. Sorry, there's works going on in my building and it's very loud on my side. But yeah, so they'll set up to 3 different goals, which will then guide the support. So we can have, as I've said before, individuals wanting to leave the home. It could be improving sleep hygiene, managing anxiety symptoms, lots of different things. It's very person-centred, as we've said. And then the individuals will score themselves on a scale of 1 to 10 based on how close they feel to reaching these goals, with 1 being not all and 10 being that they feel that they've reached that. And then their progress for this will be assessed every 6 weeks. Next slide, please. So this is just a patient information leaflet that we share to all the patients who access Community Core and just help them to understand the support that's going to be offered. So just to break this down a little bit more, we talk about how we work flexibly to meet the individual's needs. As mentioned earlier in the initial assessment, the support worker will look to accommodate their needs. So, and that can be to help and support their engagement, so the appointment type, time, goals, those different things. And we'll also look to work collaboratively with other services as well. So that could be, other people that they're already working with, or we could look to try get support referral into a different service that could be more appropriate to support needs that we can't support with, such as like financial issues, housing, different things like that. Or it could even just be holding appointments in collaboration with friends or family just to make them feel a little bit more comfortable. And if someone's a frequent non-attender, we'll always try to understand why that is and what we can do to encourage the engagement rather than discontinuing support.
Okay, so we have now different services. So the reason why we put these services, because like in the community mental health team, they get confused about which service support what. So we made this table where we have Smile, if you heard about Smile before, we have Reach and also Core. So I will for example, like with Core, I know Shaylee have mentioned about the review every 6 weeks or 6 sessions. So the ideal, we planning like within 12 sessions that we hoping that person we supported and we get to maybe complete all their goals and making sure that these support are given in the right way, and if there's any signpost at the end of these 12 sessions. However, if the person at the end of the 12 sessions did not achieve their goals, that doesn't mean it will be finished. So we can carry on and continue supporting the people within our core. Also, the support focuses on any help for individual overcoming their barriers. So we more focus about if they, for example, they feel they struggle to go and attend to their GP appointment. So this is one of the things that absolutely we will be doing and accompany that person to overcome this barrier about going outside of their home, using public transportation, going to the GP and attend that appointment with the support. And gradually maybe our worker will try to reduce the support to make sure that they can continuously depending on themselves. What we can't is we cannot get a referral from a care coordinator, just because this is supposed to be people who are, as I mentioned in my previous slide, that we could accept somebody who will be a warm handover, where a coordinator will be looking into signpost to other services and hand it over to VCS or other services available in the community. Our service is 16 plus, so we could receive referrals from children or young people. We also it's not necessarily that the people who are working with that diagnosed with SMI, or people they feel they have an anxiety or illness, and this is being they are struggling with mental health. So the good things about the support is that it is a long term, it's not a short term with a couple of weeks. While Smile, for example, is only 6 weeks, while if we are talking every other week, for some people it could be taking about 6 months. And we also like, it could be every week where we meet for 1 hour, video or face-to-face or over telephone. However, if we feel that person, he doesn't need that intense support every week, we can do it every other week. It's a tailored support, standard support. So we look into what's like the service member needs or the patient needs, and we'll take it from there of the support. If you go to next slide, please. Sherry, you're muted.
On mute. Yeah.
Sorry about that. Yeah, so this is just a case study from somebody that we supported at the Seller Trust, just to give you a bit more of an idea of what the support might look like. So this person struggled with severe anxiety and had ended up selling their shares, in their trade business. So this led to a loss of identity, issues with self-confidence, and they rarely left the home or even their bed. So they came to us for support, which we use graded exposure to help them get out of their home and increase their confidence. So they first went on walks around the park that were quite far away from their home, just so that they wouldn't see people that they knew, and that kind of helped to aid their anxiety. This then was increased to walks in their local neighbourhood, and then going to the shops and even family meals. They ended up reconnecting with an old friend who'd ended up supporting them getting back into work, which was great. And they're now going to the shops daily to ensure that they're getting out of the house and not falling back into an old routine of staying in bed all day. They said that they feel like they have a sense of purpose again. So it's just a really lovely success story that we've had. Just as I say, using that graded exposure, that person-centered approach that we're trying to use.
So, who could be referred to the to community core, and who cannot? So, people who are age 16 and over, they can come to core. People who are whether diagnosed or undiagnosed with SMI, or they have complex mental health difficulties or needs. With individual need to be registered with the GP, because we only are able to work with the GP, with people being in our locality PCN area. People will be excluded if they have already been working in secondary care and they are already receiving ongoing access of secondary mental health service, or they have a care coordinator. Again, it's if they are the care coordinator looking for a warm hand of a different case. Also, if the service member or the patient is in crisis and they need lots of support and help, this is where we were not able to support them. And also, if the patient or the service member is under alcohol or substance misuse. And usually people will ask about if, let's say, so we will offer people if they have, but they're supposed to be where they are not continuously, so they cannot come, and we cannot offer the service where they are under the substance or they are under alcohol effects. So this is where we are not able to support. But if they are working with their the GP and ask if they want to support around this, then it's a different case, and they need to be committed to not coming and engaging with the service where they are under the influence. Next next slide, please.
So we just want to look at a few of the different achievements and challenges that we've faced over the course of our time with CORE. Not necessarily in chronological order, but our most recent one that we want to mention is that we've recently started piloting a referral pathway from safe spaces. So one of the challenges that we actually faced earlier was in terms of the referrals that we'd received and how people could refer. But over the time, we've definitely streamlined that and it's made things a lot clearer. And we're hoping that with this additional new referral pathway, we'll be able to increase the terms of referrals that we get. Another achievement that we wanted to mention was in terms of the way that we've integrated in how we work and in terms of how we're based within community mental health teams. As Hisham mentioned earlier, on a weekly basis, each of our organisations are based within the community mental health teams, and that's really helped in terms of building those relationships and kind of if anybody has any questions in terms of when they're making a referral and just helping us to work better together. Following on from that, another one of our achievements has been in terms of being able to work closely with the mental health hours workers and that provision in primary care. We've definitely built a relationship with hours workers, and we've definitely been very much open to welcoming questions and just sending if you've got any questions in terms of referrals. And one of the other achievements has definitely been in terms of warm handovers. At the beginning, that was a challenge that we did have in terms of completing warm handovers and allowing that process to happen. But as the time has gone on, that process has become a lot easier. It has been very helpful for the service user to be able to come to their initial appointment with a mental health support worker or whoever it is that they are getting support from, and kind of knowing where they're going to be getting that additional support from, rather than it just being a referral and they're not knowing where they're going to be sent to. As Shelley showed earlier, we've also created a new participant information booklet, and this is something that we're going to be implementing and distributing, and hopefully be a lot helpful for clients and help them understand what the service is and what they'll be receiving in terms of the support. Because again, another one of the challenges that we faced was in terms of initial engagement from service users, and there was some apprehension in terms of they weren't too sure what the support was that they'd be getting from our service. They weren't too sure what community mental health support looked like, and that kind of led to some difficulty in them engaging at the start with the service, but we've definitely seen a massive improvement in that. And we've also been very open where people haven't necessarily been able to engage, but knowing the kinds of service users that we'll be working with, we've improved the way that we support service users. Again, in terms of expectation, not only just from service users, but also from staff, there's definitely been a level of not understanding exactly what we're trying to achieve in terms of CORE, but that's definitely something that we've overcome through these presentations, through conversations with colleagues, through sitting at community mental health teams, definitely something that's massively improved. Another challenge that we faced was in terms of which GP practice. There was some challenges in not knowing what PCN a person might be connected to in terms of their GP service and exactly where they could go for support. But again, we've cleared this up in terms of even when people are sending in a referral, it's very clear in terms of which primary care networks are covered by which organisation. And so that's been, again, simplified. And then as we've gone on, we've identified that some people have been asking questions in terms of how this is different from CORE, or how CORE is different to Smile and Reach. And as you've seen in the slide earlier, again, we've made these a lot more clearer. And as we've gone on, we've definitely seen other achievements in terms of the types of support that people are asking for. So in terms of the ones that we've identified in terms of main themes, we've seen anxiety and stress, depression and low mood, loneliness and isolation, familiar relationships and home life. And these are main themes that we've seen across each of our organisations. And we've recognised that these are main themes, and we're looking at how we can kind of work on this as we go forward.
So just as a final slide, we thought we'd do the total numbers today. So between us lead service providers, we've had 442 referrals, and these are the numbers quite even across the board. And then to break it down a little bit more, we've had 181 referrals from secondary care and 261 from primary care. And these are just our contact details.
Thank you for listening. I think we can open up for questions now. I've seen that we've got a few in the chat, and then if anybody's got any, feel free to unmute yourself. Very much welcome questions.
So there are a couple of questions. Of course, we will share the slides after this, and I think Natasha should have all your email addresses. I think, Natasha, correct me if I'm wrong. There are a couple of questions like, do core staff work with interpreters if required? Can one of the leads respond to that, please?
Yes, of course. It's a big yes. Yes, we have. If anybody, if we have a service member, a patient who needs an interpreter, 100% we will arrange an interpreter. It's like we have to have equal access for everybody. We're supposed to be doing this. So I think firstly we'll try to see if we have the language within our team. If not, then we'll seek like Enable2 or other like interpreter services to arrange this. Also, I have like another question about how can we make a referral to the service. So basically we have two pathways at the moment, which is the hours worker that Sadiqa mentioned, which is who doesn't know what is the hours worker role. It's additional roles reimbursement scheme. Which is people, not all PCNs have a primary network, have like an hours worker. The majority of them has. So if you like, if the GPs, for example, like if the service member went to their GP, and being referred to the ARS worker, the mental health worker in the PCN, then they will be able to make the refer to our core service. Each ARS worker know which like lead provider, for example, like mine, it's we don't have like Bingley Bubble, we don't have an ARS worker for them, but however we have for the Wish and for the like 5 lane ends. So we have Jody in Wish and we have Ross in the 5 lane ends.
Just wanted to comment. Thanks, Hisham, for that. So I think the referrals are slightly clearer and we are expanding as we go through. And yes, Elizabeth, we will share the slides. There is a question from Kerry Smith regarding Cody's less established in AWOF area. Not all GPs have ARS workers. Yeah, we totally are in the process of liaising with modality and WOCA regarding the ARS provision. WOCA as a PCN has got ARS provision and modality doesn't have. We are in the process of working with them. But the model there is currently is not similar to what we offer in Bradford. That the 10 PCNs in Bradford are offering currently the 9 PCNs, number 10th ones, which is BD4 Plus, will be offering this service for April. But in AirWolf, it's a different pathway actually because the community mental transformation happened in wave 1. So we are in the process of working with Pioneer Projects and Keithley Healthy Living Network and Modality and WOCA to make some parity of service model across our patch. So the discussion needs to be with the community mental health leads and the commissioners initially, but we are in the process, Kerry. Happy to have a catch up on that if required. There is another question. Yeah. There is another question from Paul Phillips. I know some work was being done on information leaflets for service users. Is this nearing completion? Yes, definitely regarding the core community provision, a leaflet is in place. And I think that was part of the slides we presented. But Natasha, can we attach the leaflet as well when we send the email out, please?
Yeah, I'll do that.
Thank you. Do you feedback referral outcome decisions with the referrer or service member only? In my experience, I haven't heard back following a referral, but think this would be helpful for our records. Can one of the service leads respond to that one? How you manage the feedback?
So in terms of, I'll take this one. So in terms of feedback referral outcome decision, so initially when we receive a referral, we definitely encourage like a warm handover and welcome you to come along to the first appointment if that's what the service member would like. And it's just kind of on that basis in terms of how involved a person wants to be. Just from that initial email is where we take it. In terms of after the person has been supported in terms of the service, we don't necessarily go back to the referrer and follow up in terms of how support has gone, but from the very beginning there will be some sort of contact in terms of offering that involvement. And if the service user does say, or if something does seem to happen in terms of whether a client's not engaging or something like that happens, then we would go back to the referrer. But if it's just a case of following on from how support has gone, we don't necessarily go back to the beginning and talk about in terms of feedback. But we have had referrals have come forward where people have wanted to stay updated on how things have gone in terms of progression. And again, it's just a case of just communicating that off that initial email at the beginning once the referrals come on. And if at any point you wanted to know a little bit more about how things have gone with the service user, again, we very much welcome sending an email and just catching up with us. We've had lots of conversations like this as we've been going along.
So one of the things is kind of that MDT approach, isn't it? Like if there is if you escalate back, since you're going into the CMHT hurdles, you are able to, if you have got a concern, you will definitely go back to the care coordinator or seek support required, isn't it? That's what's my understanding within the pathway. Yeah,
absolutely.
Yeah. We're going to move on to the next one. That's brilliant. A lot of questions are coming in the chat. Please raise your hands as well. It doesn't have to be chat. You can ask as well, so we can be a bit more interactive. So if you're supporting someone who would benefit from your service, should we tell them to speak to the GP who referred to the ARS workers? If there is referral through the community mental health teams and assessment team currently, and the second one is to the mental health ARS workers here. Yes, Catherine, that's what we would say. They could seek support from the GP and, referrals will be through ARS workers. do we ask clients what they thought of the service once they no longer use it, and have improvements been made to the service? Would you like to take that, one of the service leads, please?
Yeah, I will take this. So we are in the process of, so we are trying to develop among the 3 lead providers like a platform where we'll be sending a message to the service member when they finish. Obviously, they will be doing the last meeting if we collect feedbacks for the service, like development and improvement. However, like some people will be a bit don't want to give feedback straight away. So to make sure, we are thinking about first like do like a message with a link to fill in a form, and people who are like not able to do this, we will be sending like maybe something in the post for them. But again, this is something we are under discussion to see the best way possible to collect the feedback. But this is a work in progress that we are doing now at the moment.
Is it possible, likely that more GP surgeries might join the initiative in future? Currently in Bradford, we are, this service is developed across 10 PCNs. So we are hoping that it will be the whole footprint of Bradford district. The 10 PCNs will be covered, because we are kind of incrementally increasing the AS workers. But sometimes it's a PCN choice, really, whether to employ an AS worker or not, because it's co-funded through the mental system and primary care. So sometimes we do get some kind of barriers in getting that commitment and recruiting the right workforce. Yeah, that's our aim, definitely. So I think we have gone through all the questions in the chats. Is there anything else anybody would like to ask? It's a huge silence, actually. Is there anything else the service leads would like to wrap up with? Any more comments?
I could like make a comment on that. So we had one of our service members who attended our board. So Mind, we every quarter our Bradford District and Craven Mind, we do like a board meeting, and we see the services that we do, and we invite a service member to these meetings. So in our last quarter meeting, we invited a service member from CORE, and there was a really very positive feedback was shared with our trustees within Mind about the service and how good it was. And they mentioned about how that positively impacted their life. They are looking for work now. They have like some they felt they're being listened to, they feel being supported. So that's really good to have this positive feedback from like a service member, and that was passed to the trustees within Mind, which will encourage us all as a lead provider to do more work and more support and more help for our patients and service members, service users. I think we have a question.
Yeah. That's really positive to hear, and it's what we're trying to develop is that true sense of integrated provision, isn't it? Really working closely within our pathways. I got a couple of hands raised. Wahid, would you like to come in first, please?
Yeah, it's just a really quick question. Just, I guess, from a service user perspective, obviously it's really important that they can make contact with any of these services themselves. How easy is it for them to make contact? I.e., can they pick up the phone and sort of refer themselves directly to any of these services?
I can respond to that. Healthy Minds as a system, we have got several services. There are quite a lot of services which can be self-referrals, but the community core is not a service currently open for self-referral due to the capacity and the need of the system. Really, we are really, it's quite a small, it's for a cohort of people who really need the service. And so the pathways currently is through primary care, AS workers, community mental health teams, and the safe spaces provision, which is a crisis provision community. But there are other services we can, like Guideline, which is accessible to everybody. So yeah, but as the capacity increases and as we refine the need, it might open up, but not yet.
Thank you.
Natasha, it might be worthwhile. Oh yeah, can you put the link for the Healthy Mind services as well of our portal, please, into the chat? Thank you. Nicola, would like to come in.
Hi, yeah, thank you. It's been really, really informative. Just there was two things from me. One was if there's any way of understanding a bit more about you had in there about themes of work, and Rashmi will always know that I'm always really interested in kind of what the causes of people's kind of issues are. So I think someone said something about sleep. I think I heard stuff around housing. So if there's any more sort of further information about what people are saying that they're struggling with, you know, their kind of root causes of what's going on, that would be really useful. Not expecting that this minute at all, but just if that information's available, that would be great. And then kind of, I suppose, linked to that, I suppose, was just to sort of say, do you feel you've got enough information from kind of our side, so from the sort of council side of things, in terms of, I'm just thinking about services, so linked to things like you had on your presentation about family relationships. So I just wondered if you linked into services such as domestic abuse service, welfare advice from sort of poverty side. We've got, you know, things through the libraries in terms of reducing social isolation and employment and health visitors and family hubs. So it was more just a kind of, do you feel like those links are all there and they're happy? And if not, you know, I'm really happy to help you, establish those links and see if that can help the people that you're working with.
That's brilliant. Actually, one of the areas we were discussing was our links to housing, and we have made some contacts there now, and the service is going to go and present it in the housing support forum, isn't it, soon? So we are, Nicola, definitely there will be need for help to link up, and I'm sure, and I think the domestic violence staying put, some of them are already partners in other services, and INKIC is already the commission provider for the wellbeing advice. So there are connectivities within the services. All our service leads deliver employment support, housing support, welfare through other commissions. So there is that, that connectivity is currently there, but there is always room for improvement.
Great. Well, thank you.
There are some more links in the chat really regarding our Healthy Minds services, our portal. And if you've got any particular questions which you didn't raise here, you can there is a form you could kind of fill in, and it will come to us and we'll get back to you. So anything else, Hisham? Your hands were raised. Is there anything you want to come in with, or?
Just like to comment when you mentioned about self-referrer. The whole idea of safe spaces referrer is a start, it's a tester to see how this works. So to answer you, Wahid, we are trying. So the whole idea of having, and who don't know safe spaces is for people who are in crisis and they're really reaching the edge. So we get referral from first response and from guideline. And we have a hub in Keighley and we have a hub in Bradford. And we book a taxi for people and to come to whether like Keighley or Bradford, wherever their locality. And at the moment, what we are doing, we have a monthly meeting with the core team, with the Safe Spaces team manager, and the Safe Spaces team manager meeting just to make sure about who is like suitable, because we don't want any single person coming to Safe Spaces to go and be referred to core. So on that basis, we are looking into who's suitable for that and who came from Safe Spaces into core service, who not only needing like one-off time of support when they are in crisis, maybe there's more occurring situation and they need somebody to help them with, and this could be then a very good link between Safe Spaces and the community core.
Thank you. And Nicola, as a question, answer to one of you had two parts to your question, isn't it? One was regarding, are we capturing the presentations? I mean, all the services are using MIMUP as our data metrics, and I'm pretty sure that you're capturing the presentations. And when we have got the impact report, we can think about that, Nicola, because me and Nicola work very closely regarding she's from public health, and we work very, very closely on the needs analysis and the stats behind what does our population need. So we can look at that data to make because once we have a Q4 data, really, it'll be like a 1 year's data. Yeah.
Brilliant. Yeah, that sounds great. Yeah. Thank you.
So if we don't have any more questions, I'm going to close this session.